Hi, I'm Ruth Werner, and this is my audio-visual sidebar to go along with my article, Sepsis, the Hidden Crisis. When you read the article, you will see that while sepsis is common and really serious, it's also a little tricky to identify early, especially if you're not in a hospital or on an ambulance. I shared in the article one mnemonic, time, which is promoted by the Sepsis Alliance. In this picture, T stands for temperature, which may be higher or lower than usual. I stands for infection. There might be signs of infection, but as you'll see in a moment, maybe not. M stands for mental decline, and that one is really important. And E stands for extremely ill. In acute sepsis, the person feels really sick. I found another mnemonic that I might like a little better, and it is sepsis. In this system, S stands for shivering, fever, or cold. E stands for extreme pain or discomfort. P stands for pale or discolored skin. S stands for sleepy or difficult to rouse. I stands for I think I might die. And S stands for shortness of breath. I also talked to a paramedic who sees patients with sepsis often, and his red flags are altered mentation, like being sleepy or confused, along with increased respiratory rate. Do you get the picture here? The signs of sepsis are pretty vague and variable, but if someone feels sick and has any kind of mental confusion, it is time to get evaluated absolutely as quickly as possible. I had the opportunity to interview two massage therapists who had both recently been through this challenge, and their experiences were both amazing and vastly different, and they generously gave me permission to share what they told me with you. Our first case history is about a 62-year-old woman from Oklahoma who was in generally good health, but who had injured her liver in a car accident in her 20s, and that ended up having repercussions later. So about 3 years before her crisis, she was sure she'd had a urinary tract infection, and she had gone to the doctor for it, but at that appointment was unable to produce a urine sample. Ultimately, her symptoms subsided, but she was never treated, and she believes that this was probably the initial trigger for what happened later. And UTIs, especially untreated UTIs, are a common starting point for sepsis. Then a couple of years ago, over the course of a few months, some things for this lady changed. She developed gastrointestinal pain, so she felt nauseated all the time and had a hard time keeping food down. And she began to feel weaker and weaker and weaker in her legs. And this progressed to the point where she could hardly walk, and she started falling frequently. She became mentally foggy and confused, and finally her brother insisted that she go to the hospital. They kept her overnight, but they discharged her the next day. And the following day, she passed out at home, something that had never happened before, and her brother insisted that she go back to the emergency room. At that point, she was admitted and was found to be in late-stage renal and liver failure. Her blood pressure was 54/47. She was in septic shock. Throughout the whole thing, she never had any fever or swelling or pain, just weakness, GI problems, and mental fogginess. She stayed in the hospital for 10 days. The staff asked her, "Didn't you notice how yellow you were?" referring to the jaundice that had developed from her liver failure, and she replied, "I couldn't stand up to look in a mirror, so I never saw." At the end of her hospital stay, she could barely walk and take care of herself. It was clear she could no longer live safely alone, and so her brother has moved in with her. Today, this massage therapist is dealing with post-sepsis syndrome. She says sepsis brain interferes with her ability to think. Her stamina is very limited. Her joints hurt. Her hair is falling out. She has a chronic rash. She has also a significant shoulder injury from falling when she passed out. She does just a few massage sessions a week now, and her GI symptoms have returned. Fortunately, she is working with a doctor who is now familiar with her history. So in this story, we see a long-term, low-grade infection that hangs on and on and on and quietly takes hold. And then, over the course of a very short time, It all turns into a life-threatening combination of infection, immune system response, and inflammation. She's recovering, but she may never regain the same levels of energy and vitality and focus that she had before her sepsis. Also, she is now susceptible to repeat episodes, so she will have to be very vigilant for any early signs. Our second case is really different. This person is a massage therapist who now lives in Florida, who at age 45 had a minor outpatient surgery to correct a small epigastric hernia. Almost immediately, she knew something wasn't right. She couldn't walk from her bed to her bathroom. She had shortness of breath and dizziness, followed by fever, low blood pressure, and delirium. Within 48 hours of her procedure, she was in the hospital, where it became clear that the surgeon had nicked her bowel. She had multiple strains of bacteria in her bloodstream. She ended up on a ventilator in a medically induced coma for 15 days. She had to have open abdominal surgery to repair her bowel and to clear the infection, and they inserted several drains. The wound couldn't be completely closed in case infectious agents were still present, so it had to be packed, and then cleaning and redressing the wound was excruciatingly painful. She had progressed to stage 4 renal failure with advanced anemia, and finally, after 30 days in the hospital, she was discharged. But she wasn't finished. She ended up having to take in nutrition through a TPN, that's called a total parenteral nutrition tube, and the tube got infected too. There was no redness or swelling at the site, but her body was under attack again, and 2 days after she got home, she knew something wasn't right, and she was back in the hospital. Ultimately, this woman has long-term problems with vision, with hand-to-eye coordination and balance. She had to learn how to walk again, and the first time she walked without a spotter, she fell. She finds that some coloring books and video games are helpful for her ability to focus and work on her hand-to-eye coordination. Her kidneys have mostly bounced back. They have regained most of their function, but she is still at risk for renal issues in the future. It's been now about 2 years since her hospital stay, and she still struggles with stamina, balance, and reading. She's working with a medical team now that has the right kind of expertise for her needs, but she emphasizes that the struggles with sepsis go way beyond infection and inflammation that wears out the body. The depression and anxiety are part of her life now, and while she was trying to heal, she also had to struggle with health insurance issues for these overwhelming medical bills. She says that sepsis was a devastating experience for herself and all the people around her who felt so helpless. So here's the deal. Massage therapists are extremely unlikely to see clients in acute stage sepsis. And the person in our second case here went from her outpatient surgery to the emergency room in just 2 days. But the person in our first story had an old, low-grade, long-term silent infection, followed much later by a pretty fast progression of weakness and nausea that took place just over a matter of weeks. It happened all during COVID when we weren't doing a lot of massage, but if she had gotten on someone's table during that time, it seems plausible to me that massage might have exacerbated that situation. And now both of these women are living with the long-term repercussions of post-sepsis syndrome. Our first person has pursued massage for her injured shoulder. Our second person has benefited from specialized bodywork to help with her abdominal scarring and her posture. And there are 2.5 million people in this country who have survived sepsis. A lot of them are still dealing with the aftermath. Massage therapists might have some important skills to offer if we can do that with the right kinds of cautions and care.